So let's start up in the cervical region. It's been reported to me that like this makes some people dizzy, so I'll try to give some notice before I do a big move. Okay, so we're looking at the cervical spinal cord. You have maybe C1, C2, C3, let's see. You have a couple spinal nerves missing. I'd say C1 to C3 are gone. Can I maybe get somebody to hold this just so I'm not jostling it around? Thanks, okay. So when we look at these spinal cord examples, you're gonna have 4 of them to view. 2 of them have brains, 2 of them don't. So, I mean, it took a minute, but like pretty quickly I was able to determine that we were missing 3 cervical spinal nerves because I see these 2 structures come together. This is the start of the brachial plexus right here. This is where C5 joins up with C6 to form the superior trunk. If that like rings a little bit of a bell, cool. If not, we're talking about it next week. But a plexus is forming right here. So all of this convergence of spinal nerves, this is the formation of a plexus. The purpose of a plexus is to redistribute ventral rami inside of these spinal nerves to allow individual structures at the periphery to get more than one spinal level of innervation. It's again like a safety in numbers thing. If we have damage to C5, you still have C6 and C7 to innervate the biceps brachii, for example. So that's how we got oriented with where we are. We're missing a little bit of the top of the cord. You can see that this part of the cord right here is fatter than this part of the cord. So we're at the cervical enlargement. Now, the cervical enlargement is going to have a high amount of axons present as well as a high amount of cell bodies because that big football-shaped cervical spinal cord cross-section in histology, it's more dilated than the lower thoracic region. When we're looking at these cords, let's just assume all of them are demonstrating the anatomy anteriorly. So assume this is the front of the body plane. So these are anterior rootlets that we see coming away from the cord. We'll find that they form a root which becomes a little more apparent as we get lower. We can see some nerves, these small rootlets, converging to form roots. So an example would be right here, where you see these little things all come together. And this might be a structure that's easier to see when you're in person. But an important thing to consider, rootlets are on the inside of the cord. Roots take us to the junction of the dural sac. So roots are what form cauda equina. Your dorsal and your ventral roots, they don't come together until we meet this little hole in the dural sac that takes us to an intervertebral foramen and allows a spinal nerve to exit. So when we look at cauda equina, we'll review that again, but all things mixed spinal nerve and ventral rami, they have to be outside of this space. So this space is your subarachnoid space, and we are basically reflecting the dural sac away from the front of the cord. If this is the front of the cord, the white matter you're looking at here is going to be the anterior fasciculus that contains cell bodies, contains axons or spinal tracts associated with touch, temperature, pain, sensory function. So if this is subarachnoid space, like out here is where epidural space would be. The thickness of this sac is the dura mater. But remember, you do have arachnoid mater lining the inside of the sac. Chances are it's not there right now. With a formalin-fixed cadaver, that arachnoid layer does drop down onto the CNS. I'd imagine because it looks so clean and I don't see a layer pressed to the inside of this dura mater, I bet a lot of it's been picked away. We do have some donors where you can see some arachnoid mater in the cervical region of the cord when we get to the head and neck stuff. So directly on the CNS here, this is where your pia mater is located. We mentioned that the pia mater, it gives rise to the filum terminale, which anchors the tip of the cord and really prevents the cord from kind of like bunching up on itself. We have another important pia mater structure that helps anchor the cord. And we see it really nicely way up here. See this thin cellophane layer? You can see a little tooth-like projection of it right here. You can see another one right here. We call that the denticulate ligament. And dent, we all know what that prefix means now, so it's a tooth-like projection. We have 21 pairs of them that extend from the top of the cord to the bottom. The denticulate ligament, it's an extension of pia mater that basically just puckers off the cord to stabilize the cord on the frontal plane. A neurosurgeon told me we have to have the denticulate ligament because if we didn't have the denticulate ligament, the cord would twist on itself and everybody would end up with a spinal cord stroke. So without the denticulate ligament, the cord would move too much in the cerebral spinal fluid and the subarachnoid space. Excellent. So I think that's everything you got to see inside of the cord, at least from cervical region down to like upper lumbar. We'll slide the whole show, and oh wait, we won't slide yet. Sorry, Anson. Let's talk a little bit about the peripheral anatomy too. So we said this is all brachial plexus. These all look really good to demonstrate that dorsal root ganglion. So if we still had bony structure here, these dorsal root ganglion would be right in the holes of the vertebrae that let the individual spinal nerves pass out to the body. So if you wanted to, reinsert some bone, your vertebral canal is from like dorsal root ganglion to dorsal root ganglion. About that. Now at that dorsal root ganglion, at some of these levels, you can see a split, like right here. So the fat part is the dorsal side, the sensory side. That little skinny part would be the ventral side. That would be a ventral root right there, where it's converging to later form a mixed spinal nerve. A little more straightforward when we think about the thoracic region. I'm gonna give it a little scoot. That's good. So segmental dorsal root ganglion here. Some of them, like right here, you can see that kind of set to the side, at least from my view. You can see a little bit of definition on the screen where the ventral root is isolated or in the foreground from that dorsal root ganglion. We become a mixed spinal nerve, and like see this little sprig right there? And then you see the big thick nerve? Most of the mixed spinal nerve is ventral rami. So this is a posterior intercostal nerve, like what we already learned about in the intercostal spaces. This little sprig would be a dorsal rami that just helps innervate the dermatome and the muscles of the back at that vertebral level. So right here we're dealing with T1, 2, 3, 4, 5, 6, 7, the T7 vertebral level. And again, brachial plexus, it runs between C5 and T1. So we'll talk about it more next week, but that's how we were able to pick up quick and count those thoracic regions. Excellent. So all these little skinnies, these are all dorsal rami. So remember, roots are closer to the cord than rami. That's just a popular one for people to accidentally flip-flop. Okay, thank you so much, Anson. All the way down to cauda now. We've arrived. So cord is fat again. This is your lumbar enlargement, and your conus medullaris is less apparent on this donor than some of the other cords that we have. But nonetheless, you can see with this paper clip, I've kind of plucked one of these little extensions out. This is the tip of conus medullaris deep to all of these plastinated roots. So these aren't rami, these aren't mixed spinal nerves. These are dorsal and ventral roots that come together to form their true, let's see, I can probably count it off perfect here, L4, L5, S1 spinal nerves at the margins of the dural sac. So if I tag anything in the sac, we got to think roots and rootlets. Anything on the outside of the sac, think mixed spinal nerve and ventral dorsal rami. So if we wanted to do cauda equina, like we'd like bracket this whole area in some way. What I've plucked out of the cauda equina with the paper clip, that is the phylum terminale. So it anchors the bottom of the cord to make sure we don't get spinal cord strokes from the whole cord like bunching up on itself from the bottom up. You'll be able to always follow one extension right to the tip of the conus medullaris, and we'll find that it also contains that spinal nerve number 31, the coccygeal nerves that'll run all the way down the phylum terminale to the tip of the dural sac and onward to the very, very bottom of the tailbone. Like it's kind of anticlimactic, but like right here, this is your coccygeal spinal nerve coming out of the tip of the dural sac. You have a phylum terminale internum, meaning inside of the sac, and a phylum terminale externum, being outside of the sac. It's the same structure, the same pia mater, just on the inside versus the outside. Phylum terminale will root the whole dural sac to the front of the tailbone, or the coccyx. Quick review, let me just make sure I hit it all. We don't have a cerebrum, we don't have a brainstem. That's on your list, but it's pretty obvious. And the fasciculi are on the list, but I can't imagine that this is going to look good on the document cam. So Max, you can go ahead and stop your video just to save